When I was a first-year medical student here at the University of Chicago, my grandmother said to me, "Go see if my doctor's still there." I looked him up and knocked on his door. And I said, "Well, Dr. Kersner, I'm a first-year medical student. My name is David Rubin." And he said, "Oh, well, I remember your grandmother. And she was involved in one of our early trials looking at steroids to treat Crohn's disease." And that was my introduction to clinical trials, to Crohn's disease, and to a doctor who remembered his patients. The influence he had on me as somebody who cared and who tried to push the boundaries of what we do, that resonated with me. It was like I found what I didn't know I was missing.
There is a saying in Yiddish which is a good to neshama, which means a good soul. He just cares so deeply for his patients. It's not a job for him, it's just how he lives.
I was pretty much out of all options. They had basically said that you don't have any more options, and we think that you need surgery to have your colon removed and a permanent ileostomy. And so I came to see Dr. Rubin.
He wants every patient to feel that they're treated as if they were family. And in that spirit, he's built a IBD center here at the University of Chicago, and is known for that dedication to his patients. It's a very warm and personal and caring relationship.
The fact that he really gets to know his patients is so important. He'll, ask me how I'm doing, and I'll give him, just the typical answer of, "I'm fine." And he would take one look at me and say, "No, you're not fine. I know you're not fine."
It's a privilege to be a physician. It's a privilege to take care of somebody and to have them trust you. And you don't take it for granted.
He recognizes strengths in other people, gives them the opportunity to shine, and give people the opportunity to grow.
He every day wakes up in the morning and thinks about IBD. He comes into work, he checks in with his research team, then he checks in with his clinical team, then he's checking in with his colleagues. There's multiple layers to how he's fighting IBD.
CornerStones Health is our nonprofit medical education organization. Our simple mission was, let's blow up the way medical education is being provided currently to our colleagues and deliver something that is creative, cutting edge, and relevant so that the next patient a participant in one of our programs sees gets a higher level of care.
Dr. Rubin clearly exemplifies the characteristics for which the Shermans developed the Sherman Prize. He is an outstanding leader, teacher, clinician, educator, researcher, and he also is one of the leading people on social media in gastroenterology.
I have embraced technology, whether it's in the way to educate and communicate, or whether now in some of our research it's a way to measure the disease and to use it so that we can be more precise in our ability to control inflammation. I think that only when people are standing at the top of a mountain screaming, "We can do better," are we going to actually improve the state of what's going on. And I'm fortunate to work with a lot of great people who help us do that. And by doing so as a group, that's the way we're going to continue to change the world.